a little bit earlier, you did kind of touch on crisis situations, but I wanted to come back to that because even if you are really prioritizing the relationship, have really made progress there, there may be times when, despite your best effort, your loved one is really having an acute crisis and may need to be hospitalized against their will. So can you kind of walk through what you can do to minimize the relationship fallout there?
Well, there's a number of things you can do. I mean, first, this is less related to talking with the person, but more about setting up the whole process, is find out if there's a crisis team available, so you're not just calling 911. If you are calling law enforcement, ask if there's CIT, crisis intervention team trained officers. Can I talk to your CIT team? Because these are officers trained to interact, communicate, and we trained them through the LEAP Institute. We trained them in exactly this kind of communication to de-escalate and engage the person. So set it up if you can, and it's easy. Just make phone calls. Use Google. Is there a crisis intervention team in my community? Are there mental health crisis teams in my community? So reach out to them. Then the other thing is, once it starts, you want to, if your loved one isn't talking to you and is in the hospital and is refusing your visits, go anyway. Show up. Let the nursing staff say, "Hey, your relative is here. They want to see you." "Oh, I don't want to see them." Ask to give them a note. And in the note, write an apology. "I'm so sorry I called the crisis team or the police. I hope you can forgive me. I hope we can talk about it." Why not apologize for it? Because you're apologizing for how it made your loved one feel. You're not apologizing, for making a mistake. You did what you knew needed to be done, what you felt had to be done. And then once the person's talking, this is really important. Just listen and be empathic. I'd be angry with me too. I hear what you're saying. You feel betrayed. You feel I betrayed you. I can see why you feel I betrayed you. Because if you really put yourself in your loved one's shoes who has anosognosia, the only conclusion they can come to is that you've harmed them and you've betrayed them by, quote, throwing them into a hospital. So, if you take their perspective, then apologizing for that. And I'm so sorry. And do you feel betrayed by me? Yes, I feel betrayed. I can see why you'd feel betrayed. I would too. Then your loved one's going to ask you, then why did you do it? That's where the 3 A's come in. I'm really sorry. I could be wrong. I felt it was the right thing. I was scared. I hope you can forgive me and we don't have to fight about it. So I apologize. I acknowledged I could be wrong, and I asked the person not to argue. And I said something about how I felt. I was really scared for you. Yeah, I could be wrong. I hope you can forgive me. So that's rather than saying, well, if you hadn't started throwing things and been talking to the voices, I wouldn't have called the crisis team, or I wouldn't have called the police. If you hadn't done this, that's an educational approach. And remember, the person, it's not that they don't believe that they're mentally ill. It's that they cannot comprehend it. They can't see it. Therefore they don't believe it. I mean, they really cannot see it. So that, and we've done research on this. They can't even see oftentimes how their behavior was frightening to other people. So don't try to educate, simply just say how you felt. Well, why were you afraid? Mom, why were you afraid? Why'd you call the police? I just was. That's what we teach. I just was. I'm sorry. Maybe I was wrong to be afraid. Yeah, but I wasn't doing anything. I wasn't yelling. And rather than say, "Oh, you're yelling again right now," just say, "I was just afraid. I'm sorry, I was afraid." LEAP is not intuitive, right? I mean, you want to say to the person, well, you were yelling, you were throwing things, right? When the person's stabilized on medication, then you can start to have some of those conversations. If you think that they can develop some awareness of their behavior and how that triggered your calling for an involuntary treatment. But really, it's focusing on the relationship and the feelings each of you are having.